People feel tired every day, have low energy, muscle pain, or frequent colds, but they don't know the real reason. One of the most common causes worldwide is vitamin D deficiency. Introduction. Hello and welcome to the channel. I'm a medical doctor, and on this channel, I explain common health problems in simple, evidence-based ways. Today we will talk about vitamin D deficiency, what it is, why it happens, common symptoms, and how you can safely correct it. What is vitamin D? Vitamin D is a fat-soluble vitamin that plays a very important role in the body. It helps regulate calcium and phosphorus levels and keeps our bones and teeth strong. But vitamin D also affects the immune system, muscles, and even mood. Unlike most vitamins, vitamin D can be produced in our skin when it is exposed to sunlight. Why do many people have deficiency? There are several reasons why vitamin D deficiency is so common today. First, many people spend most of their time indoors. Second, sunscreen blocks the production of vitamin D in the skin. Third, people living in northern regions receive less sunlight during many months of the year. Other risk factors include obesity, darker skin, pregnancy, and certain digestive diseases that affect absorption. Symptoms of vitamin D deficiency. Vitamin D deficiency does not always cause obvious symptoms, but many people experience constant fatigue, muscle weakness, bone pain, frequent infections, low mood or depression. In children, severe deficiency can lead to rickets, a disease that affects bone development. How is deficiency diagnosed? The best way to diagnose vitamin D deficiency is with a blood test called 25-hydroxyvitamin D. Doctors usually consider levels below 20 nanograms per milliliter as deficiency, and levels between 20 and 30 nanograms per milliliter as insufficiency. However, interpretation can vary depending on clinical guidelines. How to increase vitamin D. There are three main ways to improve vitamin D levels. First, sunlight exposure. Spending about 10 to 20 minutes in sunlight several times per week may help the body produce vitamin D. Second, diet. Foods rich in vitamin D include fatty fish like salmon and mackerel, egg yolks, fortified dairy products. However, diet alone is usually not enough. Third, supplements. Vitamin D supplements are commonly used when deficiency is confirmed. Safe supplementation. Supplement doses vary depending on the level of deficiency. For many adults, doses between 800 and 2,000 IU per day are commonly recommended for maintenance. Higher doses may be prescribed by a doctor when levels are very low. It is important not to take very high doses without medical supervision. Conclusion. Vitamin D deficiency is extremely common worldwide, but it is also easy to diagnose and treat. If you experience fatigue, muscle weakness, or frequent illness, it may be worth discussing vitamin D testing with your doctor. If you found this video helpful, subscribe to the channel for more simple medical explanations about common health problems.